Unavelaku. I love you guys and take care of yourselves. It's like the whole world is affected by it. Hello everyone and welcome back to Being Xiluva. Minjani Vana. So today's topic is very personal, very emotional. It's a global pandemic, and I am part of the statistic. So I'm hoping that this video is going to inspire you to do better. I mean, this wouldn't be a holistic self-care if I didn't speak about this. So I'm facing the fear, got my red lipstick. Yeah, so I have my notes here so I don't lose track. So my experience of being COVID positive. Yeah, so where do we start? So we start at when you tell someone you COVID positive. The first question is, how did you get it? And for me, I don't know where I got it. It could have been at a store. It could have been when I was going somewhere. Yeah, it could have been at work, could have been anywhere literally. And so yes, the biggest question is to ask is, why did I get tested? So at work, the director of the company that I work for, she told me that we were in contact with someone who was positive, so I needed to go get tested just in case. So on the 15th of June 2020, I got this news and I panicked. Literally, I was like panicked. I was like, okay, what do I do now? Where do I go now? And I didn't want to panic the people that I was around. Like, I didn't want to tell them, hey, I wanted to first find out for myself if I am COVID positive, because I live with people and there were people that I was in contact with. So I just needed to go get tested quickly, find my results, and then move on from there. So there's a friend of mine that I immediately called. Actually, I just texted on WhatsApp first, and then she called me back and she advised me on what I needed to do. So I went to Intercare, and because I moved, I don't have a GP and I don't have medical aid. So I used the last money I had to go get tested, and it was expensive. For real. So I knew that the priority was to know if I was positive or negative. So I didn't care about the money at that point. I was just like, let's just find out what's happening. So firstly, you see a GP, and the GP prescribes you like that you need to go get tested with your storic. So I was in contact with someone who was positive, so they got me to get tested, and Lancet did the test. So it went right through my nose, and it was not that painful, but it's uncomfortable, so you just need to relax. And then after that, she took the sample, and I just needed to wait. So if you know, in South Africa on the 16th of June, it's Youth Day. It's a public holiday. So I waited. I stayed at home, didn't go anywhere, didn't see anyone, didn't go to the shops. I just stayed home. And then on Monday, on the 17th, so It was Monday, Tuesday, on Wednesday, yes. On Wednesday, on the 17th, I got my results, and my results said I was positive. So that day I was working, and I literally had like turned off my phone because I needed to focus. And when I switched it on around like 10-11, I got my message and calls from the doctors to say, hey, you're positive. You need to call for consultation to tell you what you need to do now. That was also expensive, guys. Online consultation is not free. Yeah, I told everyone that I was in contact with that I got my results. Let's just pause for a sec. I'll be back. I had lipstick on my teeth. Anyway, fix that. It's all out. So yes. So where was I? Yeah, I got my results. So I told everyone that I was in contact with that, hey, I'm COVID positive. Some people didn't take it well. Some did. Oh, I don't even know. You're supposed to take it well? Like, they were grateful that I told them that I was COVID positive, right? So, yeah. So they got tested. Some self-isolated. Anyway, how long does it take to recover? It takes 14 days, 2 weeks, not 7 days, 14. However, in the first 7 days, that's when your symptoms start to show. And for some people, they don't show. So just take the 14 days, okay? If you need to work from home. Yeah, just take that week off, those 2 weeks off, and just take care of yourself. Your health is more important than anything right now. Okay, so how did it feel? Okay, I will be honest, guys. I was seeing family. We were not self-distancing, okay? We were sitting at a table, having breakfast, having lunch. We would cook together. There was no self-distancing. Okay, there was no 1.5. But when I got my results that I was positive, damn, guys. My family was super strict. I stayed in my room for the whole 2 weeks by myself, no visitors, no one coming to say hey. And for those people who know that from the 15th to the 1st, no, from the 17th to the 1st of July, that's a whole full 2 weeks. And it's my birthday on the 25th. So I used the bathroom by myself, and I had my room to myself. And every time I had to leave the room was with the mask or scarf on, because just to not affect the people that I was around. Yeah. So how I felt about that was just fear. I think when when I went to Intercare and I was filling the forms, I had a dreading, like, fear that I was going to die and that I was so young. Then I thought again, some things just happened for a reason. But then I filled in everything. Okay, so I'm back home, and my first day of self-isolation, I cried because my family was so strict, guys. They're so strict. They're like, if you're not taking this seriously, I'm gonna force you to stay in your room. I was taking it seriously. I did stay in my room. I knew that depending on a person, it might affect them differently. Like for me, I had my own kind of symptoms where I just had a fever. I would shake a lot. I would have headaches, which I don't normally get. Yeah, those were some of my symptoms. So what I did initially, my aunt called and she's like, hey, I heard that you're positive. Okay, so what we're going to do now, I'm going to tell you what you need to do. We're going to go buy medication. You need to ask someone, or it's going to be delivered for you from Clicks. And then the other thing, you have to have your own utensils, your own plate, your own spoon, your own cup, mug, bowl. All that needs to be put aside just for you. And then the other thing was, I just needed to take care of myself and know that my family loves me and they're concerned about me, and they hear for me if they need, like, actually everyone that I knew they knew that I was positive was just so supportive. I'd like to say thank you to them for that, because I think also I wouldn't have been able to recover so quickly if it wasn't for that support. I know some people I didn't tell because I didn't want them to panic, because I knew there was some family members that would panic. I mean, we all deal with things differently. So yeah, so that was that. That's how I felt. I had fear for myself, and I had fear for the people that I was in contact with, because they needed to go get tested. And it's not free. Okay, now it is at some hospitals, by the way. If you want to get tested, there's specific hospitals or clinics that you can go to and get tested. If you want me to tell you my experience, because I did go there. I did go because I wanted to know for the people that I was with, because there's so much stigma around when someone is COVID positive, and it wasn't me. I think when you see someone like move away from you, you're like, okay, then I will also move away from you. So there's that stigma, and just for everyone to feel safe, I wanted to know if I could get tested. And if I could get tested, I did get tested, by the way. And after getting tested, and when they found out that I already had my results, they were like, well, we don't do that anymore. We don't test you after finding out that you are COVID positive, especially if you have been self-isolated for 14 days. And for me, I had gone over 14 days before I even went back to go get tested. I think it was another like 3 or 5 days after my self-isolation that I went there, and they're like, no, you're okay. You can even go back to work. So I was like, okay, thank you. So yeah, so that was my experience of it. But if you like, I don't know, comment, like, and subscribe. So the last question is my advice to people who are COVID positive. I'm going to pause again just a little. Sorry about that. So I'll speak to all those who are positive and all those who are negative. Okay, let's start with the negative people. All of you who know that you are COVID negative, these are specific things that you need to do wherever you are. I don't care, okay? You need to prioritize yourself, your health, and the people that are around you, okay? So before you get tested, even if you think like you have a flu or something, but if you know that you're negative, things that you need to do is stay home. Stay home, guys, please. You're helping. Unless you're like an essential worker, then just take precautionary measures. Keep that mask on. Have hand sanitizer at hand. Yeah, those are so if you're an essential worker, do those things. And all those who need to go to work, please just keep your mask on as well. Hand sanitize as well, because it's everyone. Your lives are important, not just to yourself, but to the people that love and care about you. Okay, so yeah, those are the things that you need to do. Also, practice social distancing. At least be 1.5 meters away. I've been doing it at home. It's not easy. No hugs, okay? No hugs. Elbow greeting. This is your friend. Elbow greeting. And or you can even greet with your feet, just do like a tip tap with your foot. That's the only physical like touch that you'll experience right now. Okay, for now, until I don't know when. Until they say we can all start, like after lockdown is over, then you can be all touchy, hug each other, be like free. But right now we can't be free because there's an amicable disease out there. Okay, is it amicable? I think I'm using the wrong word, I'm sorry, but there's a contagious infectious disease out there. I think it's communicable. Yes, but anyway, and then because now they say that the disease is airborne, please just stay warm as well. Being warm, staying warm, eating healthy, those are like your friends. Those are the things that you need to do. Stay warm, wear jackets, I know the sun is out, but it's cold, so please just be safe. So I think, yes, when I get into medication, those who are negative, you also need to listen closely, like hear me. So those who are positive, and they went and got tested, if I knew like before, or if someone had talked to me and said, hey, these are the 5 things that you need to do, I would have appreciated that. But my aunt was there to be like, hey girl, we have experienced this, so these are the things that I'm telling you to do. So that was very helpful. So I'll mention it again. But the first thing that you need to do, because when you find out that you are COVID positive like myself, I cried the first day that I self-isolated, but not just because like my family was being super strict. I also knew that I had a disease, I had a virus in me that I could end up going into hospital. It might just become critical. But the first thing that you need to do is First thing that you need to do, I'm so sorry. First thing that you need to do is beat your negative thoughts. Yes, beat them down, kill them. Okay, do anything you can to just be like, I'm not listening to you, I'm doing me. Okay, I'm taking care of me, I'm prioritizing me. So just any thoughts of like I'm about to die, or I don't know, might just be critical. I think of it like what I did. I was like, I'm gonna take it day by day. Okay, whatever happens, whatever symptoms I have, I'll take them day by day. So now that I'm self-isolated, what I need to do is think positive. Have little things that I do that just make me happy. For me, I was working at home, so that kept me very busy. I didn't have time to think about my feelings, my emotions. So that helped a lot. So be busy. If you're sleeping, sleep as much as you want. Enjoy those dreams. Have amazing dreams, okay? Like, do what you think makes you happy, because that's gonna just motivate you. And think positive. I also know that because you found out that you're COVID positive, just like myself, there were things that I couldn't do anymore. And because of that, I needed to find ways to then get things going. Because I mean, these are days that I can't take back, time that I cannot take back. So I was with work. I started working at home, but I was working at home anyway. But like, I even got a table, if you can see, that helped a lot. So just start making things easier, like some kind of way, for you to fulfill those goals that you had. It's just that they might be delayed a little bit, but just find other ways to fulfill them. And then 2, have people that you trust. I know for me, when I found out that I needed to go get tested, I had a friend who told me where I needed to go, what I needed to do. I had my aunt who told me what I needed to do. I had my brother that I live with who would go buy things for me, medication for me, and things like that. So you need people that you trust, and that helps a lot. So you need to tell the people that you're with so that they can also help you recover. Because if you are sick, they're kind of sick as well. Like, it affects them too. 3, have people that support your circumstance. Okay, I'm COVID positive, and my mom, my dad, my granny, my aunts, everyone was calling, supporting. Like, my siblings, everyone was like, hey, how are you? How are you doing? Okay, they'll have like slight jokes here and there just to make me smile. That was nice. So yeah, just have people that really like a support structure. That helps, especially when you're self-isolating, when you're by yourself. Like, you need that assistance. It's not just a call. It emotionally and sort of spiritually helps you get out of feeling sorry for yourself, because now you hear that someone you never even thought of would like call all the time. Like, I had my granny calling me, guys. I had my granny calling, my 82-year-old granny calling me to be like, girl, you okay? So that helped a lot. Another thing, 4 is to take medication. Okay, I know this one is gonna be a bit long, but take flu medications. As you know, COVID is like flu, it's just that you can't see it. So just get medication. So you're asking, what medication? We ain't told no medication. Yes, I'll tell you what medication to take. So vitamin C, multivitamin, multigard, any of those. Okay, well, not vitamin C on its own, but multivitamin would be the best to take. Vitamin C just as an extra, like, just to help out. So multivitamin is important, but buy one that is affordable to you, because I know they're expensive. Yeah, very expensive. Cinetab, Avril, Benlin, ACC 200, Vicks VapoRub, the liquid. I know at some point for myself, I had like a sore throat, and what I asked my brother to buy me was what was it? Okay, I'll get back to it. Okay, let me just pause and think about it. Thank you. So it was Med Lemon, stony, and I would have that every evening with my medication. All of these. I didn't care, okay? But I'm not a doctor, but I know that I'm sick. I knew I was sick. So I took all of them. And I would also have tea with lemon. My brother couldn't find ginger, so it was fine. Yeah, so those are the things that I took. Those are the medication. If you have any other like medication that you know of that helps when you have like a cold, flu, I would say take that. And take that and take more of it, because, and this is why I'm saying for people who know that they're COVID negative, just need to take medication. If you feel any kind of way, just take that medication, because it's gonna help you not get to a critical state. Yeah, so you're like combating it before it becomes too hard to handle. And then the last thing is that the government will call you just to find out if you are okay and that the people that you're in contact with are okay. And if you want more information, go to the National Institute for Communicable Disease. Yes, it was communicable. Yes, so National Institute for Communicable Disease. It's nicd.ac.za. They give you like tips on what you should do when you self-isolating, what you should do for your children if you have children, how to take care of they give you tips basically on what to do. So that was very helpful. And like if you have the time, you can also call the hotline. Call the hotline, find out from them what's happening. But I think if you just go to the nicd.ac.za, they sort of part of the hotline, then you'll find all the information that you need. But if you don't have the resources to do that, then just call the hotline. So those are the 5 tips I have for you. If you're wondering what were my symptoms, I had fever. I would sweat a lot. I still do now. Shaking, shiver, sore throat. I would feel very tired and weak. Oh, there were times where I was like, what am I gonna do now? And headaches. So those were my symptoms. I still have some of them. So what I should let you know is, if you do find out that you're COVID positive, your symptoms will still linger for a while, because your body is beating that virus. And still take your medication. I still take like multivitamin even now. I'm not playing with nobody around that. And regarding the stigma, if you find that people move away from you, this is how I think of it. Okay, at first I'm like, this person thinks, but then after that I'm like, you know what, maybe, just maybe, they're helping me to not get even more sick. Because what happens is when you're COVID positive, you actually can easily get any other disease, can easily get any other virus, because your system is very weak. That's why I still take multivitamin even now. If I feel a little bit sick, then I do something. I take medication. I know some people don't like medication, so use like natural herbs, like ginger, lemon, turmeric. Use those things. They really help. They're not there in the world for nothing. They're there to assist us. So yeah, I think that's about it. So just think of it as they're helping you. They're really helping you to not get even more sick. Yeah, until the next video, please like, subscribe, comment, let me know what you think. If you have any other tips that you think would be helpful for people who are COVID positive or negative, write it down, let me know, let everyone know. Yes, I don't know if my symptom says I am COVID negative, because they said that I can't test again. So, and also, by the way, before I forget, I'm so sorry guys, there are some people who might get the symptoms but find out that they are COVID negative. I would say do all the things that I told you. Self-isolate, take your medication, have people that support you, have people that you trust, and beat it with your mind. Beat it. Think positive. And then there are some people who might go and get tested again and find that they're positive. I would say to you, self-isolate, and if you've done your 14 days, just take medication, wear your mask, and make sure that everyone around you is safe. Okay, gotta go. Bye. Unavelaku. I love you guys, and take care of yourselves. Please don't forget, prioritize yourself and your family, especially now since it is a pandemic it's like the whole world is affected by it. So just be safe, do what you can, and until the next video, thank you.